Yeah, osteoarthritis is a disease that affects the articular cartilage in joints, and pretty much everyone gets osteoarthritis at some point. If we live long enough, we're going to have osteoarthritis. So the articular cartilage in our joints is really, really smooth. In fact, it's so smooth, it's about 1/8 of the friction of ice on ice. It's so smooth. And what happens with osteoarthritis is that tissue breaks down. And so then you start getting friction between the two surfaces. And as that breaks down more, then the friction that is there causes further erosion and damage and deterioration of the articular cartilage.
Deepak Kumar, a Boston University assistant professor of physical therapy, said, "We're observing that physical therapy can reduce the odds that a patient will be a chronic opioid user in the future." In your experience, how accurate is this statement?
Oh, I think it's really accurate. There have been a lot of studies that show that the pain associated with arthritis is a lot more correlated with someone's activity level than it is with the actual progression of the disease. So what I'm saying is that if you look at two people and one person has really progressive arthritis, a lot of breakdown of the tissue, of the cartilage, and another person has that same amount of breakdown, but these two people are very different in their activity level and how much they move and walk and exercise and those things. The person that has a lot higher activity level is going to have a lot less pain. So we know that pain is really associated more with behavior and the way that we interact with our environment and activities than it is with just simply the progression of the disease. So yes, we know we're all going to get arthritis if we live long enough, but if we can do the right things to reduce the load on those joints, we're going to have a lot less pain. So the pain comes when there's, as I say, a lot of load on parts of that damaged joint. And there are things that we can do in physical therapy and independently to reduce that load. So that can make a lot of difference. People with moderately bad to severe arthritis often will not need any opioid help at all. They can get by with the help of anti-inflammatories.
How exactly can physical therapy interventions be more beneficial for pain management than prescription opioids?
The key is to reduce the load on those joints. And the main ways that you can do that are to normalize strength of the muscles around the joints. Because for most of our joints, it's muscle strength that really provides most of the stability of the joint. So you've got to get your muscles strong and in balance. You can't have some muscle groups around the joint way stronger than others. There's got to be good balance. So muscle strength. And then flexibility. It's really important to have those muscles flexible around the joint so the joint can bear load normally. And lastly, there are postural type of issues where we can make sure that we're normalizing the posture of someone and that joint to reduce the abnormal load on it. So all of these things and more can be done to reduce the load on an arthritic joint and therefore reduce pain.
The world's most common form of arthritis is knee osteoarthritis. How can we prevent developing osteoarthritis?
Well, unfortunately, we can't prevent developing arthritis. Osteoarthritis, at least. It's going to come if we live long enough. But we can do a lot to prevent it from becoming worse than it otherwise would be. And we can prevent it from being as painful as it needs to be. And that is through the things I've mentioned before, keeping your body weight down to a healthy level, normalizing muscle strength around the joint, normalizing muscle flexibility around the joint, keeping a good level of mobility up and joint flexibility and activity. And then lastly, normalizing posture around the joint. And sometimes that will require some real expert guidance to see what might be causing the slight postural shift that's causing more load on that joint, and we can certainly help with that.
Great. So that leads me to my next question. Is there anything we can do on our own to mitigate any pain resulting from osteoarthritis?
Yeah, the key is stay active, stay moving. Now, if you're hurting really bad, you don't want to be pushing through the pain, because that can make the joint worse. That can make the arthritis worse. But if you can move, and the rule of thumb we say is that if you're able to exercise or move, and if there's pain there and it starts to subside as you're exercising or moving, then keep it up, keep going. But if the pain increases, then it's probably not the right exercise for you, and you should get some advice on the exercise you should be doing. But bottom line is, yes, stay as mobile and exercise as well as you can in any form that doesn't cause pain.
Great, thank you.
You're welcome.